Hello everyone, welcome back to my channel. I am Dr. Prabjot Singh, MD Anatomy from AIIMS, and let us study about the perineum in this video. What is perineum? If you look externally, perineum is the area between the genitalia and the anal orifice in case of males, in females, including the genitalia. And if we talk about internally, it is the area that lies inferior to the pelvic diaphragm, that is inferior to the levator ani. So definition, it is the area or region inferior to pelvic diaphragm, which is mainly formed by levator ani. I hope that's clear. So let's move ahead with its boundaries. So we have over here in males, over here in females. Anteriorly in males, it is the posterior end of scrotum. Posteriorly in both males and females, it is buttocks. Laterally in both males and females, it is the thigh, the inner thighs. In case of females, anteriorly it is different. It begins from mons pubis. So external genitalia is not the part of perineum in males, but it is the part of perineum in females. That's why in females the perineum is also known as gynecological perineum. I hope that's clear. Okay. So these are the superficial boundaries. The boundaries of perineum are actually studied in two forms. Boundaries are studied as internal boundary and external boundary. The external boundary is the one that we have covered. Internal boundary is same as anatomical outlet. This you will study in the section of pelvimetry in anatomy or in obstetrics and gynecology. So I'm not going to the detail as of now in this video with respect to this. Now, if I have a look, the perineum is like this. Over here, let's take example of the males. You have the posterior end of scrotum. Over here, you have the ischial tuberosity. So at the level of ischial tuberosity, you divide this rhomboid into two. The anterior one is urogenital triangle and the posterior one is anorectal triangle. I hope that is clear what is anorectal triangle and what is your urogenital triangle. So let's continue. So over here I have attached the two images. Now we will understand the perineum based upon these images. So this is the male genitalia and this is the female genitalia. In the male genitalia, you can see from the posterior of the scrotum lateral to the ischial tuberosity, you have this anterior triangle. This is the urogenital triangle, and posteriorly you have the anal triangle. In the case of the females, let us draw. Let us imagine over here you have the ischial tuberosities. Like this is going to be a posterior triangle, and like this is going to be your anterior triangle. In females, the anterior and the posterior triangles are not equal, whereas in males they are almost equal. In females, the anterior triangle, the urogenital triangle, is larger in comparison with the anorectal triangle, because in females The genitalia is the part of perineum. In males, genitalia lies over here in front of perineum. So that's the major difference. So now let us understand what are the structures opening in the perineum. So in urogenital triangle and in anorectal triangle. In urogenital triangle, you have urethra, vagina in the case of females. In anorectal triangle, you have anal canal. I hope you know that vagina will only open in the case of females. Okay? Now, what are the other subdivisions of this, other contents of these triangles? These were the openings. Now let us talk about the contents. So you have the deep perineal pouch, superficial perineal pouch, and ischiorectal fossa. These are the openings in these areas. So in this video, I will talk about the pouches. The ischiorectal fossa will not be dealt in this video, otherwise बहुत लंबी हो जाएगी और बोरिंग हो जाएगी और आप लोग देखते भी नहीं यार इतनी लंबी वीडियो, इतनी मेहनत करवाते हो देखते भी नहीं हो यार उसके बाद. ठीक है, तो ischiorectal fossa अगली वीडियो में दिखाऊंगा मैं क्या होता है. I mean पढ़ाऊंगा, not दिखाऊंगा. I hope you are getting it. Okay. Now the contents of urogenital triangle के बारे में हम थोड़ा सा बात करेंगे. I'm not going to talk about एक रट्टे वाला point of view से, but I want you to understand. So I want you to understand some basic structure and some basic criteria. Okay. So सबसे पहले in the body, I'm going from superior to inferior. This is basic outline समझने के लिए perineum की structure. Urogenital triangle. So let me note it down first that I am beginning with urogenital triangle. ठीक है? So from superior to inferior. So over here I have pelvic diaphragm. This is the pelvic diaphragm, mainly composed of levator ani. Just inferior to it, I have the superior fascia of urogenital diaphragm. Urogenital diaphragm क्या होता है अभी देखेंगे, तो समझ में आ गया. superior fascia. Similarly, I have over here the inferior fascia of urogenital diaphragm and perineal membrane that is extending till your perineal body. Perineal body क्या होता है अभी हम देखेंगे थोड़ी देर में, don't worry. And over here you have your urethra. ठीक है, but चलो urethra छोड़ो अभी. So this area from here to perineal membrane is basically your deep perineal pouch. Then over here you again have a line. This is your Colles fascia and this is your superficial perineal pouch, and then you have your perineal skin over here. इतना समझ में आ गया? अगर इतना समझ में आ गया, so I will expand this diagram further. So I'm drawing the perineum in the case of a male. अगर आपके पास में मेल कैडेवर है या फिर आपके पास में अगर मैं मेल की बात करूं तो मेल में कैसा दिखेगा, आई एम ड्राइंग दैट. Okay, so the structure that I have drawn in blue, that is the urethra. But let us understand the parts of urethra. Urethra comprises of three parts: prostatic part, membranous part, and spongy part. Prostatic part is the part above the superior fascia. Over here, the part of urethra that you have is the prostatic. In the deep perineal pouch, the part you have that is membranous. In the superficial perineal pouch, you have the spongy. So, with the help of the pouches, you can also differentiate. In the deep perineal pouch, you have a muscle over here. This is known as external urethral sphincter. Apart from that, you have certain transverse muscles located over here. These are known as the deep transverse perini. Okay, the DTP, deep transverse perini. So the question comes: urogenital diaphragm is comprising of. Let us understand the urogenital diaphragm now. Superiorly, it is bounded by the superior fascia of urogenital diaphragm. Inferiorly by inferior fascia of urogenital diaphragm, and it is made by external urethral sphincter plus deep transverse perini, structures passing through it in males and in females. Urethra in both the cases. In males, you have the corpus gland. In females, you have the vagina. Oops. Okay. So now let us draw the corpus gland. Corpus gland is present over here with its duct opening in the spongy part of urethra that is present in the superficial perineal pouch. So this is corpus gland. So in exam you need to understand कि डक्ट पूछी गई है कि ग्लैंड पूछा गया है. ग्लैंड है आपका डीप पाउच में, डक्ट है आपकी सुपरफिशियल पाउच में. Okay, and apart from that you have over here this green dot that is dorsal nerve of penis. So let us recall this diagram once. You have a pelvic diaphragm. Inferior to the pelvic diaphragm, you have the superficial fascia of urogenital diaphragm. Then you have the deep perineal pouch. This is the deep perineal pouch, and this is the superficial perineal pouch. In the deep perineal pouch, you have the deep transverse perini, external urethral sphincter, corpus gland, the membranous urethra. These are the structures that are present in the urogenital diaphragm or at the level of urogenital diaphragm or in the deep perineal pouch. Then in the superficial perineal pouch, you have the spongy urethra. This one I forgot to label. It is the bulb of penis. It is the bulb of penis. Over here you have the dorsal nerve of penis. So these are the parts of basically these are parts of urethra that are present in the superficial perineal pouch. And over here you have the Colles fascia. So with that we are done with the deep pouch, superficial pouch. आप लोग यहाँ से देख के contents लिख सकते हो अपने notes में. Now only one thing that I'm going to talk about is two structures. Sorry, one is the perineal body and another is the perineal membrane. So let me draw one simple line diagram. Over here you have the superior fascia of urogenital diaphragm. Over here you have the perineal membrane, and over here you have Colles fascia. So anteriorly, the perineal membrane and superior fascia of the diaphragm are originating from a common structure that is behind the pubic symphysis, and perineal membrane extends till the perineal body. Posterior to the perineal body, mind you, right now I'm talking about this triangle, and over here you have the perineal body. Posterior to the perineal body, in the anorectal triangle, the perineal membrane splits into two. One layer goes superiorly, another layer goes inferiorly. So, perineal membrane has two layers now, that is the superior layer and inferior layer, posterior to the perineal body in this region. Superior layer, it merges with superior fascia of urogenital diaphragm. The inferior layer, it merges with Colles fascia. That is about the perineal membrane. Now about the perineal body. What is perineal body? Perineal body एक गांठ है. It is a site of insertion of certain muscles. कितने muscles? 10 muscles. It is a site of insertion of 10 muscles. So these 10 muscles जो हैं आपके, these are basically inserting at one point, and they are forming a knot-like structure. So that knot-like structure is nothing but the perineal body. So let us understand that what are the basically structures that are inserting into the perineal body. So there are 10 muscles. So these 10 muscles are basically inserting in the perineal body, and so we have 4 paired and 4 unpaired muscles. So the 10 muscles, so they can be classified as 4 paired and 2 unpaired. So what are the paired muscles? Paired muscles are superficial transverse perini, deep transverse perini, levator ani, and bulbospongiosus. And the unpaired muscles are basically the longitudinal muscle coat of rectum and external anal sphincter. That's it about this video. अगर वीडियो आप लोगों को मेरी अच्छी लगती है, so don't forget to like, comment, share and subscribe, and do follow, do subscribe, and you can also reach me at my Instagram, that is by the name of S Prabjot or Anatomy by Dr. Prabjot, and I hope you're enjoying the videos. Bye bye.